I'm Jim Williams. I am Communications Specialist for Boulder County Housing and Human Services. Well, the 2016 Community of Hope report evolved over time from an idea that we had around producing a comprehensive annual report for Housing and Human Services. It quickly became clear in early 2015 as we began work on it that producing an annual report is one way to do it, but another way to do it would be to really kind of take a full and holistic, comprehensive look at all of the services that we provide within more of a social determinants of health framework, which means all of the interconnected things that help make people healthy and increase community well-being. As we began to look at that as a more holistic sort of circular idea of interconnecting circles, it also became clear to us that we as a department share many of the same clients with many of our other departments around the county. And so the work that we do isn't done in an isolated silo. We wanted to reach out a little bit and begin a process through which we could produce a report to the community that is about our collective work, our work with each other as departments, our work with our community partner organizations around the county. And so the Community of Hope report evolved to become something that was a much more comprehensive look at not only what HHS does, but what some of the other departments do, and was also an attempt to lay the groundwork for a deepening of that as we go forward. And so the hope is that 2017, 2018, increasingly we will begin to pull the work of other departments, other programs serving these similar clients into this reporting mechanism that we have. I think we probably ended up with 36 people who are actually involved in compiling data, writing some of the content, helping us understand what the outcomes of these programs have been. And so over time we had easily a dozen or more teams that were involved in it. And we've gotten a lot of great feedback on it from community partners, from the public, from people that some of the directors go out and meet with, and they can take the report and they can say, here's a look at what we do as a county.
I'm Frank Alexander. I'm the director of the Department of Housing and Human Services, and from my perspective, the most important thing in working within the human services and health and housing systems is that we have a common vision and work toward a common purpose. Aligning together as a community around what we're trying to achieve is priceless. It's immeasurable. It brings talent and resources and vision and focus to what are very complicated problems. The Community of Hope report is really the main vehicle for communicating those community priorities. And without having a common vision that's supported by data and humanizes what it's like for people to experience dislocation in their lives, everything that we deal with becomes more difficult. They look like separate programs, they don't have a common alignment, they're not designed to achieve a set of common outcomes and leverage each other. So we learn to work together better, and the Community of Hope report helps us do that more than anything that we have.